People who are taking GLP-1s for weight loss are really just taking it from people who are diabetic who really need the medicine. Have you ever heard that? Have you ever heard that statement? By the way, that's not true. I want you to write in the comments if you've ever heard that. I'm doing a video specifically on that statement because as a family doctor, it just came to my attention that there are a lot of people out there who think that people who take these GLP-1 medications, whether we're talking about, Wegovy or Zepbound or whatever, are actually taking meds away from people who may be more deserving, who have diabetes, who are diabetics. Let me sort of smash that myth to pieces and explain what really is going on. Guys, I'm Dr. Jen. It is good to see you. Okay, by the way, let's use Ozempic as an example. Ozempic is an earlier GLP-1. A lot of people know about this medication. Ozempic is the molecule semaglutide. Ozempic, that medication, is FDA approved for diabetes. Now, semaglutide, which is the molecule in Ozempic, also exists as a separate medication under a different name called Wegovy. So there are two separate medications, two different prescriptions that exist for the same molecule, semaglutide. Semaglutide as Ozempic is for diabetes. Semaglutide as Wegovy is for people who need to lose weight. Now, the differences are that they have different FDA indications. One, Ozempic is for diabetes, Wegovy is for weight loss, for people who are obese or overweight with at least a risk factor. The other difference is that they are different dosing. It's not the same doses, okay? But they are both prescriptions and they are separate medications. So this is what explains and how it explains that no, people who are taking GLP-1s for weight loss, who are taking the appropriate medicine for weight loss, who are taking the weight loss version of the GLP-1 for weight loss, they're not taking it from people with diabetes because people with diabetes have a separate medication for them. Let's use tirzepatide, okay? That molecule exists as Mounjaro for diabetics. So if I have a patient who's a diabetic, I'm gonna write on the prescription, Mounjaro, da-da-da-da-da. But if I have a patient who's not diabetic, who needs to lose weight and fits the weight loss criteria, and I wanna prescribe tirzepatide, I'm going to prescribe its weight loss version, Zepbound. Same molecule, different brand name, different indication, same medication, but different doses, different FDA indications, separate prescriptions, okay? I'm gonna prescribe the weight loss person Zepbound, okay? So once again, if you're trying to lose weight, you should be prescribed the weight loss version of the molecule, the one that's FDA indicated for weight loss. You should meet the criteria. There is specific criteria, etc. If you are diabetic, your doctor should be prescribing you the diabetic version of the molecule and meeting the criteria for that. Now, let me say, because you're probably going to say, well, not everybody follows the rules. And you are so right about that. Not everyone does follow the rules. There are some doctors who are writing these medications off-label. What does that mean? That means that they are giving Ozempic, which is the diabetic version of semaglutide, not to diabetics, but maybe to patients who need to lose weight. Yeah, it's the same molecule, but it is a different dosing and it's not the right indication. So that is happening, okay? It is also happening that, yes, we have had shortages of GLP-1 medications. And we also do know that with the weight loss versions of these medications, sometimes people have taken the weight loss medications without fully meeting the criteria. So that has happened too. There are other situations and scenarios too, don't get me wrong, okay? I'm not saying it's a perfect system. I'm admitting that there are problems and it's not perfect for everyone. However, please understand that someone being on a GLP-1 for weight loss, when they are appropriately prescribed the medication by a licensed practitioner and they are taking it according to the directions by the FDA, etc., they are not and should not be shamed or blamed or criticized. Theoretically, they are not taking away a medication from a diabetic because a diabetic has its own medication, the other version. Yeah, there are shortages. There are, people inappropriately writing it, etc. But that's a different story. So I say all this to say, and the reason why this came up was because I don't want people to just assume people taking GLP-1s for weight loss are bad or wrong. No, these medications have changed the game. They're not for everybody. But honestly, we know that weight and weight gain and obesity and being overweight, it's multifactorial. We used to blame people for being overweight. Oh, you're just not trying hard enough. Oh, if only you tried harder. Oh, you just need to work harder and you'll put in the work. But now we know that a decent amount of obesity and overweight is genetic. We know that it's based on where you live and access to food and all sorts of socioeconomic things and things like that. It's not to say that diet and exercise is not important. It's just to say that the blame game needs to stop. And also blaming people for taking GLP-1s for weight loss when they are indicated for it and taking it appropriately, that needs to stop too. And no, they are not taking medication away from diabetics, because diabetics have a version for diabetes. Let's take it easy on folks and be gracious and give people grace. And make sure you talk to your doctor about all of this stuff to help clear stuff up, because there's a lot of rumors running around on social media, etc. Write in the comments if this video was helpful. I don't know if it was. I just heard this from someone. I was like, I should do a video on this. But if you think everybody knows this, then I don't know, maybe I'll take the video down. Let me know. Was this helpful? Was it not? Are some people going to be like, oh, that's good to know, or not? I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of things. Please subscribe to my channel on YouTube. Please follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, all the things, and sign up for my free health newsletter at drjencaudle.com.